I'm Dr. Robert Smith. I've spent years working with people who want to stay active, comfortable, and independent. Have you ever looked in the mirror and felt like one stubborn roll just won't budge no matter how much you diet or exercise? Did you know liposuction is one of the most commonly requested cosmetic procedures worldwide, performed hundreds of thousands of times each year? Yet many people misunderstand what it actually does and what risks are real. Liposuction is a surgical procedure that removes localized pockets of subcutaneous fat to reshape body contours. It is a body contouring tool, not a weight loss cure. Liposuction works because the surgeon mechanically disrupts and aspirates subcutaneous fat. A tumescent solution is injected to numb the area and constrict blood vessels. Then a thin tube called a cannula breaks up and sucks the fat. The fat cells removed from treated areas do not simply come back there, but weight gain afterward enlarges remaining fat cells elsewhere. So maintaining healthy habits matters for lasting results. It is very common in high-income countries. In the United States alone, procedures number in the hundreds of thousands annually, and demand has grown as techniques and anesthesia safety have improved. After the procedure, expected symptoms include soreness, bruising, and swelling for days to weeks, numbness or altered sensation where nerves were stretched or compressed, mild oozing from small entry sites, and temporary skin irregularity as tissues settle. Seek immediate medical attention for red flags such as new or worsening shortness of breath, chest pain, sudden palpitations or collapse, rapidly expanding painful swelling or a tense collection suggesting a hematoma, high fever, spreading redness, severe increasing pain, or foul-smelling drainage suggesting infection, or sudden vision changes, weakness, or severe confusion. For persistent fever, steadily worsening pain, or wound concerns, contact your surgeon promptly. Why do stubborn fat pockets persist even after weight loss? Genetics, sex, and hormones largely determine fat distribution. Men tend to accumulate more visceral and abdominal fat, while women often have more subcutaneous fat on hips and thighs. Aggravating factors include weight cycling, poor sleep, high-calorie diets, alcohol, and some medications that promote fat storage or local inflammation. Practical steps you can start tomorrow include committing to a realistic activity plan such as 30 minutes of moderate exercise most days, plus 2 resistance sessions per week, prioritizing protein at meals and reducing refined carbs and sugary drinks, improving sleep and stress management, and booking a consultation with a board-certified plastic surgeon to discuss goals and realistic expectations. After surgery, compression garments help reduce swelling and support contouring. Over-the-counter analgesics like acetaminophen can manage pain, and cold compresses reduce early swelling. Topical firming creams may provide subjective benefit, but will not replace surgical contouring. For patients with excess weight, medically supervised prescription options such as GLP-1 receptor agonists can produce meaningful weight loss when appropriate and monitored. Liposuction techniques range from tumescent to energy-assisted methods like ultrasound or laser. Choice depends on area, skin quality, and surgeon expertise. Preoperative assessment of BMI, comorbidities, and venous thromboembolism risk, use of tumescent technique, thromboprophylaxis, and early mobilization when indicated are all evidence-based practices that improve safety. Refer to a board-certified plastic surgeon for persistent localized fat pockets that affect quality of life after non-surgical measures, and seek multidisciplinary care for complex cases such as massive weight loss with excess skin or prior surgical complications. Typical recovery allows a return to desk work in about a week and gradual return to strenuous activity over 4 to 6 weeks, while minor irregularities, temporary numbness, or small seromas occur in a minority, and major complications are rare but serious. Importantly, liposuction alone usually does not improve metabolic markers like blood sugar unless paired with broader weight loss and lifestyle change. This talk is educational, not a diagnosis. People of different ethnic backgrounds may scar and heal differently and have varied fat distribution. Surgeons should discuss these differences and cultural expectations, Never stop prescribed medications without your doctor's guidance. If you are considering liposuction, be empowered. Learn the facts, choose an experienced board-certified surgeon, optimize your health beforehand, and set realistic goals. With the right information, the right team, and thoughtful preparation, you can make a safe, confident choice about body contouring that fits your goals and your life. This information is general and does not replace a consultation with a qualified healthcare professional. If you experience any red flag symptoms described earlier, seek emergency care immediately.